So today we have with us here Dr. Warren, who is a clinical psychologist, and she's also a former associate professor at the University of Nevada in Las Vegas. She is a PhD in clinical psychology from Texas A&M, and she also has done and completed a clinical internship from Harvard. Having given several TED Talks and published her book, Lies We Tell Ourselves, The Psychology of Self-Deception, Dr. Warren is truly an expert on eating disorders and the practice of psychotherapy from a cross-cultural perspective. So truly there's nobody else that's better than you for this discussion that we have planned out for us today. So as you may know, Doctor, there's so much focus on the way that we're feeling about our bodies and the way that we perceive our bodies during this time, because when there's a lack of human interaction, you're most focused on yourself. And so you're so self-critical. So we have a couple of questions here for you, which we hope can help all those people out there that may or may not be thinking about these things. So the first question that we have for you today is, what kind of pressures do you think the quarantine that has been placed by governments across the world, what kind of pressures do you think they have created for achieving the perfect body? Now that people don't have an excuse to, slack off, and now nobody can say that I don't have enough time. So what kind of pressures do you think this may place on a person?
I think that it's such a unique experience for most of us. The idea that we're stuck at home and we're quarantining, and we really, in that context, most of us are feeling a considerable amount of stress. Mm-hmm. In addition, our routines, as you said, are completely thrown off. So whatever you would ordinarily do in your life to stay fit, to stay healthy, to eat well, are probably not available to you in the same way. And so one thing that I have noticed a lot since COVID started is messages from people saying, I'm at home, I can't exercise the way that I ordinarily would, even though I have a lot of time. I'm not eating the way that I ordinarily would, partly because I'm worried about food, partly because I may not be able to get the food that I usually have. I'm looking at canned food. I'm looking at food that isn't perishable.
Exactly.
And I'm feeling stressed. And when we feel stressed, oftentimes we indulge in overeating, whether it's a more severe form of overeating, like a binge eating, where you're eating a large amount of food in a short amount of time and feel an inability to stop yourself, feel that overwhelming, overarching kind of shoveling food in your mouth where you feel out of control, to just kind of grazing all day, where you notice you just stop by the refrigerator and you're eating another thing and eating another thing, which isn't something perhaps that you would do in your ordinary life. And that reality of being stressed in your home, worried about the world, worrying about some things that are going on that are very heavy in the world right now. And being in a space where you really don't have a lot of the coping mechanisms to deal with stress that most of us usually use, like seeing friends, having social support, being able to go to the gym if that's something, or even just take a walk outside, may be very limited right now. So there are so many things going on that I think for the average person who perhaps doesn't have more severe eating struggles in general, it's putting food and bodies in the forefront in a way that we're not used to. And if you are someone who happens to struggle in a more extreme way with body dissatisfaction, not liking the way you look, noticing you're checking yourself in the mirror constantly, being very dissatisfied with your eating behavior, noticing that you're getting more restrictive with your eating, creating more rules for yourself, this may be a particularly difficult time because it's something that you're going to have to manage and navigate in a way that you're not used to.
Yeah, and I think at some point it just becomes like a vicious cycle that you start binging, and then you're overcome by like guilt, and then you stop eating completely. Many people with eating disorders are facing that currently, and it's super sad. Like it's really sad how we're placing so much pressure on ourselves. Do you also think there could be like a split side of this? I mean, well, not necessarily a split side, but like another consequence of the quarantine could be that maybe placing too much pressure on ourselves and just being overly conscious of, some people may be being overly conscious of the kind of food that they're consuming, just because naturally there's not as much as activity. You know how people tend to get like 10,000 steps a day, and all of those numbers are super hard to achieve when you're just trapped at home. So do you think that there's also people that are overcompensating by just not eating at all?
Absolutely.
Yeah.
I think that probably what we're noticing is that it would be really the exception for you to not have a reaction to living through this pandemic by noticing some shift in your eating or body image. One thing that we know in psychological literature pretty clearly is that under conditions of stress, one of the first thing that shifts usually for any human is our eating behavior. And it's very common to either gain weight or lose weight. And when you think about feelings of being out of control right now, most people are experiencing some discomfort with the fact that there are all kinds of things happening in the world that we have very little control over. And one thing that we tend to do when that happens is try to find something to control that we do have power over. And so food can be one of those things for us. And it could very easily turn into more extreme restrictive eating, as you just pointed out, as opposed to overeating, depending on who you are and how you deal with stress. There are plenty of people in the world who respond to feeling uncomfortable in their own skin or experiencing some external stress that perhaps doesn't have anything to do with your physical body by not having an appetite or not wanting to eat. And you really pretty well articulated the kind of cycle, as we would describe it, of eating when it's dysfunctional, or when we would say it's somewhat pathological or unhealthy for you, where you may have a tendency to notice that you're overeating, you start to feel guilt about it, you start to look at yourself in the mirror more or see if your clothes fit. I'm not going to eat. And then you're in this cycle where you restrict. You think to yourself, oh, if I don't eat anything until noon tomorrow, I'm having a very good day to make up for the fact that I ate more than I wanted to yesterday.
Which is so dangerous.
Yes, it disposes you to binge, overeat, feel really badly in the future, because restriction is part of the cycle of overeating for almost everyone.
I mean, yes, for most people, eating just has a very, very large emotional component as well. So I think this is a consequence of that. So to build on that, do you think that the extreme focus on health and fitness during the COVID-19 pandemic is bringing further impetus to the notions of the ideal body, which is something that corporations are capitalizing on, and then they're making all of these products and marketing strategies that seek profit at the cost of everyone's mental duress about their body and their body image. So are you concerned that this is something that corporations might start capitalizing on, or if they're already doing so?
I think we have to sort of at baseline accept that the goal of beauty-oriented marketing at some level is to make you feel badly about the way that you look. Because the goal is to get you to buy a product, whether it's a dieting drug product or a special kind of food or makeup or plastic surgery or whatever it is. The idea is, I can show you that the way that you are currently is not good enough, but if you buy this thing, then you can better approximate our cultural ideal, right? So I think, yes, certainly marketers will take advantage of people's dissatisfaction to try to sell products. And I think that that's always the case. I think one thing that gets a little bit complicated also right now is that we do have some research coming out that suggests that high body mass index, people who are overweight or obese, are ending up hospitalized more often when they have COVID. And in general, in the United States and globally, we have all of this information about the obesity epidemic that we are in, that people will say, such a high percentage in the United States, for example, of individuals are overweight or obese. And so there's already been a focus on weight, both an idealization of extreme thinness and I would say, discriminatory attitudes about obesity that are kind of occurring simultaneously. And so weight is going to be front and center, I think, now. And as we come out of this epidemic, my hope is that our focus shifts away from weight to health, and that weight is certainly included in health. You can weigh too little and you can weigh too much. And there's strong evidence that neither of those are good for your health. But I think that the more we can try to embrace, how can I get through this in a healthy way for me? What's a healthy appearance ideal for me based on who I am, what I look like, my height, my age, et cetera, the better off we're going to be as a community of people.
Absolutely, because I mean, I feel like the world that we live in today, I think the terms weight and weight control are just used interchangeably with fitness, though that shouldn't be the case. I mean, that's not the only factor that, cashes in when you're talking about overall fitness. So that's definitely something to think about. So how do you think that individuals and societies at large may be engaging in various forms of self-deception during the pandemic?
Oh, I think that with regard to eating, it's really, really easy for all of us to try to justify however we're eating to make ourselves feel better. So you may say to yourself, oh, I'm going to eat this bag of chips, or I'm going to eat this entire chocolate bar, and I'm just going to indulge because why not? I'm stuck at home. I'm afraid of the realities that are going on.
Who's going to see me anyway?
Nobody's going to know. What's the point? I can't get outside anyway. I can't exercise really anyway, right? And all of those are not true, right? They're all deceptive. And at the end of the day, none of it is going to help you psychologically feel centered and good about your choices, because they're all going to serve as self-deceptive justifications to make you feel better about things that you probably don't feel very good about. So I would so much rather have people, if you're feeling emotional particularly, or if you're feeling stressed and upset, to pause before you eat anything. Just pause and ask yourself very simply, in a non-judgmental, non-critical way, why am I eating this? Just why am I eating this? Am I actually hungry? Am I feeling reactive? Am I feeling scared? Am I feeling uncomfortable? Do I just need a distraction? Am I bored out of my mind? Am I frustrated with the fact that my life is in chaos, right? Just pause. And as you answer the question for yourself, the beauty is you become more aware and conscious of your motivations, and those can guide your choices. So then you get to say, okay, you know what? I am feeling incredibly angry and stressed, and I'm going to let myself eat this bar, this candy bar, even though I don't really think it's good for my health. But right now, that's the choice I'm making, and I'm consciously aware of it, and I'm going to admit it to myself and anybody who asks me. That is a much healthier place to come from than trying to justify it in a non-true way. Or maybe you say to yourself, you know what? I am just eating out of stress. I'm not hungry at all. I don't want to do this to myself anymore. I'm going to choose to do something else. So instead of responding to my stress by eating, I am going to go and call a friend of mine, or journal, or read an article on how to manage stress and practice some meditation and relaxation exercises, something else, so that you are making really conscious choices about how you want to respond to the current reality. All of us live through really painful life realities, all of us. And right now we happen to be going through one together, right? Where we're all in this together globally. We don't,
I mean, at least for the foreseeable future. I mean,
at the moment.
Yeah.
We don't have any control over the existence of COVID, over the fact that people are getting incredibly sick, but we have 100% control over our response to it. And as long as you can keep that in mind, you will empower yourself to make choices that leave you feeling as good as you can feel, given a life reality that's very challenging.
So this is actually what my next question was going to be about, but you pretty much summed it up. What I was going to ask is, do you think that, overcoming self-deception and moving towards authenticity and honesty can help us deal with the pandemic and its aftermath better? Because this seems to be a reality that we live in for at least the foreseeable future, especially because there's so many countries where, either the curve is only is beginning to flatten or it hasn't flattened at all. So this is something that we might have to live through. So how do you think that, apart from these practices, of course, what would you recommend to someone that has now become aware of the fact that, that they engage in self-deception? So what recommendations would you have for them as they move towards, self-authenticity? Yeah.
Well, I will make a very strong argument that I pretty much always, I'm going to say always, I rarely say always or never, but think that our goal is to be as honest with ourselves as we can be. I think that the more—
You think intrinsically as humans, all of us?
Yes. The goal is to understand yourself as deeply and honestly as you can, and the world around you. Because from the place of truth, from the place of an honest awareness, you can then make choices that empower you to live a life responding to the real experience as it exists. And I think that's about as good as it's going to get. You take the information that you have as foundationally true as you can make it, and you are given an opportunity to create the life that you want to live, where you can look yourself in the mirror and say, I do not regret my life. I made choices consistent with who I am and who I want to be, even in the face of really difficult realities. And it's very hard to have a lot of regret when that's how you live your life every day. It doesn't mean your life isn't going to be hard. It means, though, that you can sleep at night knowing that you are a person that you can trust and believe in. And I think that's awesome. That's what we really want and need. That said, it's incredibly painful to be honest with yourself, because you have to develop enough psychological strength and esteem to tolerate unpleasant realities without having it break you, without having it melt you and implode you into painful psychological symptoms.
Absolutely.
So it's a lifelong journey. It's something that we have to consciously practice all the time, because the minute you acknowledge something that's true but painful, you're gonna feel this like ping of ouch, like ouch, I don't want that to be true. I don't want to know that about myself or about my family or about my culture and my community. It's painful. I don't want to know that that's true, but it is. And once you get over that little ping of pain, you are now free to do things differently. And over time, you will develop more psychological strength and empowerment so that it gets easier. Seeing the truth gets easier. Also, once you see something as true, it's very hard to unsee it. I can't show you something is true about yourself and then have you go back.
Exactly. It's hard to go back.
It's really hard because it's out there now. It's like telling your friend that you intentionally want to go and exercise today and then not doing it. You're now far more accountable. You can't convince yourself that you weren't going to go exercise because you've already put it out there.
I feel like when you say it out to the universe, it's just there.
It's there. You see it. You got it. You can't deceive it away in your own mind.
Exactly.
So start practicing by pausing. That's really my first recommendation for people. When you notice that you're saying something that isn't true, pause. When you notice that your feelings don't match your current life reality, pause. When what you say doesn't match how you act, definitely pause because there's something that's not aligned there. You need to pause. When you have a really strong emotional reaction to something in your life, pause. Before you do anything, blame anyone, point fingers externally, stop and ask yourself, what does this say about me? What can I learn about myself and my inability to admit the truth in this situation? And how can I now see something that I don't want to see and use that information to propel me forward? That's how I would start.
So you think that acknowledgement really is the first step to, dealing with your emotions better? Absolutely. So for a lot of us, sorry to cut you off.
Well, you can't change something you can't admit. You just can't. It's like the fundamental tenet of addiction. You cannot be an alcoholic in recovery until you can see that you have a problem with alcohol. It is going to be really hard for me to.
That's always the first step. Yeah.
So when it comes to any self-deception, the first step is to see it and to admit it to yourself, to become aware that something is true that you have been avoiding, denying, rationalizing away, trying to explain through cultural conditioning, trying to understand by placing the blame elsewhere. You have to start by admitting the truth.
The truth.
Yes. Awareness.
Exactly.
Starts with awareness. And then with awareness comes responsibility and choice. Because once you become aware of something, you're now far more responsible for the consequences. And if you don't change with the new information, psychologically, you're going to feel worse.
You're going to feel worse when you know that it's something that's happening, but you don't do anything about it anyway. Yeah.
Okay, feel worse. You know better. You know better now.
You know better now. Exactly.
It's the true ignorance is bliss meaning. If you're unaware something is affecting you, it doesn't hurt you as much. Once you admit it, if you don't do anything with that information to change, it's going to hurt you more.
That's when it really gets to you. Absolutely. So for a lot of us, for all of us at an individual level, it is a very individual and personal battle, just being quarantined. For a lot of us, we're alone. We don't even have family with us. Dealing with our emotions can truly be challenging. But that being said, do you also think that COVID-19's impact has mainly been along demographic lines, such as, the elderly versus the young, the healthy versus those with maybe pre-existing health conditions? Do you feel that social and cultural identities may also, play a role in the pandemic and how we're dealing with it and its aftermath as well?
I'm sure that they do. I think that in terms of psychological research, one thing that we see in the United States certainly is that the history of race and ethnic discrimination in our country leads to differential trust in medical communities and can very strongly influence access to care as well as a desire to seek medical attention because of beliefs that it will not be handled ethically or well received. So that's one example, a small example of how demographic factors influence the actual manifestation of who dies from this illness, not only who gets it, but who will seek treatment and how that will manifest. I think culturally, there are different sort of levels of tolerance for seeking medical attention, where some people are, or some cultural groups are more trusting of going to doctors and seeking care at a earlier stage in an illness, at an earlier stage when your symptoms aren't so severe, whereas others, you are going to have to be really, really struggling before they're going to seek any medical attention, which can influence how things progress. Even things like who has insurance and who has medical care, access to medical care, particularly given our unemployment rates right now.
In the United States, it's a pretty big problem. Yeah.
So I think demographic variables are hugely intertwined with how COVID is going to play out. Yes. I think
Also.
also even cultural norms around eating and around food will shift some people's experiences on lockdown, where if you're coming from a more collectivistic or communal background, you may understand the reason for social distancing and the value of social distancing and not passing on an illness that you may have and not even know to a group of people who you would see perhaps on a regular basis or have communal meals with, or family meals with your extended family and friends. In more individualistic groups, it may be that you are more focused on your own personal rights and the fact that you don't think you should have to deny yourself walking outside without a mask or going to a restaurant to eat because it's not your job to take care of other people. So I think you'll start to see some of those belief systems that can be associated with racial groups, ethnic groups, socioeconomic groups, cultural
so that
groups.
sense of community is something that differs across like different racial groups. Like there's a
Absolutely.
very different sense of community. Yeah, that makes a lot of sense. Yeah.
And identity. It often comes down to identity. How do you self-identify?
Yeah, and I also think that the concurrence of the movement that is happening in the United States right now, the George Floyd aftermath, as well as COVID-19 happening at the same time. So I do think that the concurrence of these events is something that's really bringing to the forefront issues of cultural identity in the time of a crisis. So yeah, that's definitely something to think about. Building on that, do you think that multiculturalism and multicultural awareness is something that can make us better equipped for dealing with times like the COVID-19 pandemic, or any such global crises in the future? Do you think this cultural awareness, this multicultural awareness, is something that can help us be better equipped for times like these?
I think multicultural awareness, competency better equips us to be better human beings, period. So yes. Does it better
bringing on that other perspectives?
Yes. Appreciating differences, understanding our own biases and how we got them, how we learned them, where we learned them, becoming aware, again, coming back to honesty and self-deception, becoming aware of where you have racial biases, which is something that's coming out very much globally right now with George Floyd, as you mentioned. How you internalized cultural messages about race, what you learned about being a racial person for yourself, for those around you, and how to navigate difference while respecting people's value is critical to handling any kind of crisis in the world, period. So I think a deep examination of ourselves and how our racial identity and experiences with racism and discrimination influenced who we are, the lies we tell ourselves about race and health, are really, really critical, in addition to educating ourselves about people and about what we in psychology study very well about identity formation and race. So for example, looking at things like racial identity models, where you're trying to understand the process and experience of people of color and whites living in a patriarchal racist culture, and how living in that culture influences your development, your identity, your attitudes, your beliefs, where you learned beliefs as if they were true from your culture that are in fact false, but you still processed them as true. You're not going to unprocess them until you see them. Again, it comes back to the awareness. So you have to be willing to look at what you believe and whether it's true or not and where you learned it. And oftentimes one of the most difficult part, I think, of issues of multiculturalism and race, certainly right now, is that consciously, most of us do not believe in racist ideology. And we don't ever want to think or suggest that we could be racist in any way, because consciously, we don't believe it. We don't think that race determines whether you're
Or we
more.
don't want to believe it. Like we don't want to believe that we're capable of something that's considered so, inherently evil. Like we don't want to believe that this is something that we're possessed by, but it's, in a lot of cases, we're not even aware of the kind of biases and prejudices that, we have in our subconscious. So yeah.
Exactly.
Mm-hmm.
So consciously, we stop ourselves from that examination oftentimes because it's too painful. It's too uncomfortable. It's too uncomfortable to think I hold prejudices against another person or another group, whether it's based on race or class or sex or sexual orientation or weight status. There's a ton of anti-fat attitudes in the world.
Absolutely.
It's too painful to think, well, I am capable of that. We don't want to admit that. But until you are willing to look at that, you will never change it, because it will operate in your unconscious level, but it will seep out in your thoughts, in your behaviors, in your attitudes, in ways that you probably can't see.
So in a way, examining that part of yourself is also a step to perhaps self-authenticity, being honest with yourself. Great. So
Yes.
those are all the questions that we had for you today. But is there anything else that you would want to say to the people that are watching this? All of us, trapped in our houses. Do you want to say anything, or do you have any suggestions for any of us to deal with the situation better?
Yes, I would say, in addition to pausing, be your best self. Strive to be your best self. Do not look at the process of honesty and examining self-deception yourself as one that allows you to beat yourself up or be judgmental and critical. We know psychologically that being judgmental is not associated with psychological well-being for any of us. So I would encourage you to start this journey from a place of love and compassion and care, and think of it as a big experiment to try to understand yourself so that you can become and grow into the best version of yourself while also acknowledging and accepting who you are today. It's a dialectic. It's the desire to understand and accept who you are paired with the necessity of change. They both exist at the same time.
That's really something to think about. But I really want to thank you for, first of all, honoring us with your presence and taking out, I'm sure, your precious time. And then you have kids at home, like you mentioned. Thank you so much for doing this for us. And I'm sure all the people that are watching this are going to take away something very insightful. And something I'm sure they're going to be able to use this productively. So thank you so much for being with us here today, virtually, of course. But I'm so glad you were able to make it. Thank you so much.
Thank you. It was delightful to talk to you.